If you want to practice medicine in the UK, you'll firstly need to register with the General Medical Council. This film explains who the GMC is and what we do. We've also asked some other doctors for their advice on things you need to know about practicing medicine in the UK. Throughout your career, the General Medical Council will provide guidance and support to help you be a good doctor. The GMC is an independent organisation that helps to protect patients and improve medical practice. We do this by keeping an up-to-date register of qualified doctors. We decide which doctors are qualified to work in the UK and are able to meet our standards. We also set the standards for medical education and training. We do this by defining the knowledge, experience and behaviour that are required of doctors. We make sure doctors continue to meet the standards we set throughout their careers and that they're supported in doing so. One of the ways we do this is through revalidation, a system that means licensed doctors demonstrate that they are keeping their knowledge and skills up to date. We make sure doctors are fit to practice medicine. If there are concerns that they're not meeting our standards, we look into them and take firm but fair action where patients are at risk. All of this comes down to setting clear standards for doctors in the UK. We do this through our core guidance, Good Medical Practice. In order to be safe and effective throughout your career in the UK, it's your responsibility to make sure you follow the key principles set out in Good Medical Practice. We ask some established doctors to share their experience of putting these important principles into practice.
Teamwork is absolutely vital in the NHS, and everyone's realised that if you all work together, you achieve so much more than if you're battling each other. And I think this has happened from senior to junior doctor going downwards, and I think there's much better rapport.
In the UK, we have the advantage of having different disciplines work with each other towards a common goal, and it's very important to actually work with different professionals with that vision of actually making sure that the patient care is the centre of whatever you do.
I do a lot of teaching with junior doctors. The issues that they bring up with me are exactly the same issues that I used to face when I first started. Working excessive hours, but also positive stuff, things about how nice it is working with teams and the buzz and the kind of job satisfaction you get from having a team around you and from actually helping patients.
Teamwork is about respecting our colleagues, listening to them and making sure we provide the best care for the patients.
From going to the top of medical school where you're deemed to know the most, to going to the very bottom of the ladder again, you have to have a certain amount of humility and a lack of arrogance really about that.
Some coaches from the different countries find it quite hard to ask for help. You should ask questions, otherwise you're just gonna run into loads of difficulties and make mistakes which people would rather you ask, and even like a very silly question.
Ethics are very important in medicine, and obviously it's one of our oaths that we take at the very start. If you feel that there's an ethical dilemma, I would suggest you speak to someone about it. There's always people there for you to talk to, whether they're within your own organisation or outside it.
Ethics is not fixed. Ethics is based across culture, across practice, across law. Understand what is current best practice. That's the important bit, because what was acceptable 50 years ago is not acceptable necessarily today.
I believe trust is extremely important. Your patient has to be able to trust you. Having a rapport with the patient and being able to communicate with the patient is very good, but just being trustworthy to patients means a lot.
Doctors do hold an image of being trusted and being someone who can be approached with a problem. So I think it matters what doctors do outside their office hours is I think equally important.
Things like social media where you're tweeting away and you can say whatever you feel like to the entire world, and suddenly you make that transition to being a doctor. It is very, very difficult to navigate those boundaries. It's very easy to say, yes, doctors should be held up to a higher standard, but when you look at that in practice, it's really complicated and it's very hard, I think, for doctors, and I know doctors struggle with it.
Patients don't understand medical jargon, and blinding them with jargon is often detrimental and counterproductive to your communication and your relationship that you build with the patient. So I think communication is perhaps the most important thing in hospital patient management?
It's very important how you communicate to the patients, and you're trying to adjust to their level of understanding. So you obviously have to explain things in a very simple language which people will understand.
The last thing the patient or the relatives want is somebody talking to them and them not understanding a lot of what is being said. So trying to simplify what is happening and putting that in layperson's language, that's not something that is difficult for overseas doctors. It's difficult for doctors who are trained here as well.
Listen to the patient's problem, be patient about it, don't bombard the patient with your questions, let him speak.
You should be able to understand what your limitations are. You've got to discuss the pros and cons with the patient, making sure that you understand the sensitivities of the patient and what the patient is up against, because you are a bit fragile when you're unwell, and you've got to be able to empathize, not just treat.
I think in the NHS, the main thing is to make sure that you respect patient rights and confidentiality, and make sure you work well in a team and are clinically competent.
You're there for the patients. You're there to do good to society, to treat every patient as an individual, and effectively to try and do your best to make them better and get them out of hospital.
We believe that every patient should expect a high standard of care. By following the standards set out in good medical practice, you can have a safe and successful career and make a valuable contribution to UK healthcare.